So I'm going to speak today about another stream of work that we've done within the umbrella of VOPD called Can Digital Transformation Improve the Situation for Healthcare and Social Care Workers? So I have organized this presentation into the problems, the stories, and a way forward. So we start off with the problem. Well, the problem is known to many people, but the challenge is how do we make sure that we have the staff we need to be able to perform the services as we should. So this is a very multifaceted challenge that we're having. Many different challenges have to be addressed. And if I go through the first one is demographics. This is actually the starting point where we started VOPD. And if you look at this slide here, it says there is not enough capacity in the municipalities to meet the rising demand for services. Meaning that people are getting older and older, especially in remote and rural regions. And this person from a municipal manager in Norway are saying it would mean that 1 out of 3 would have to work within healthcare and care nationally. So it is a huge challenge for us all. Another challenge is connected to budgets. It takes time and it's complex to get an overview, estimates what this transformation will cost and how this will affect the staff working. But it's also other challenges connected like procurement processes and data storage, etc., that has to be addressed. Another major component when doing this digital transformation and make it good for the staff is that this is a major managerial difficult task in explaining the purpose of this. What does this mean to nurses working at the floor? What does it mean to doctors, etc., in the healthcare and social care system? So we often say that a large part of this digital shift is connected to culture, leadership, and organization, and this is part of this. Recruitment is a fourth challenge that we highlight here, and it has been more difficult to recruit in the fields of social and health professionals, including both assistant helpers, but also more higher educated personnel. And this is especially true in remote and rural regions. And if we speak about retaining the staff in the positions, this is also a challenge when it comes to social care and healthcare, especially social care in larger regions, cities, where this is often an entry job into the labor market for many people to start off work with social services. So if this is the challenge, we can see that, if this is the challenge, you can see that all of these are interlinked. They are all interconnected and they are all depending on each other. So you can't work with one only challenge. You have to address all challenges to create a good working environment for the staff that you are serving. So what do we need? We need a radical improvement. Can digital transformation help is the question that we have put ourselves. So we have collected a number of stories. We have made 15 interviews in 3 different regions in the Nordics. Sogn and Fjordane, North Jutland in Denmark, Sogn and Fjordane in Norway, North Jutland in Denmark, and Exote in Finland. Out of these 15 interviews, we can identify 4 main insights that we would like to share with you now. So the first insight that we see, if you do digital transformation, this can make the job, the work easier and more flexible. This is coming out strongly, basically in all interviews that we see. Technology has made my job much easier. It's now easier to justify new ways of working when there is also evidence of the benefits. So this is very clear coming out from the workers across, that it becomes easier to work and they get more flexibility built into their daily work. The second insight is that digital transformation can give the employees more time to focus on what is really important. So when it becomes more easy, more flexible, you get more time to devote for tasks that really require your attention. This is what the quotes are saying here. And nurses can use more of their time to use their competences in time where it's more important, thanks to digital transformation, is one quote stating. The third insight that we see is a little bit higher meaning to this. Digital transformation can provide a greater meaning to the job. What do we mean by that? Well, it's not only the work that the healthcare workers and social care workers are doing, but it's also, as one professional expressed it, the professional have experienced that increased use of telemedicine has had a greater meaning and value because they can see the solutions are of great importance to the citizens. So it doesn't just become easier and more flexible and they can devote more time for what is important. They see also the benefits to the citizens in this, and that creates a greater meaning to the job for the workers, of course. So it's a win-win situation, what is coming out of these interviews. This is also strongly coming out. The fourth insight that we have on this one is that digital transformation can increase the status of the job. Well, the status of the job is important, and this is very much coming out from the management level that are saying this. They want to organize the work so it becomes more prestige to work with social care and healthcare in a new modern way. This is the regions that are speaking to us. The regions that we selected, I should say this, the 3 regions are a little bit forerunners when it comes to digital transformation. So telemedicine have given the nursing profession greater prestige and have been good for the nursing professionals' self-understanding. So it boosts the self-confidence for the workers. It's very interesting. So that was the 4 insights that you have on top right here. And what we are saying then, that digital transformation can improve the working environment for healthcare and social care staff. So the main conclusion that we draw from this is digital transformation is a key component to create a good working environment for healthcare and social care personnel. So the way forward, well, the name of the project is Competence Provision and Organization of Healthcare and Social Care. What is organization of healthcare and social care? Well, to give an example, we put this question out. How many online patient consultations does a car trip cost? Well, we all understand time in the car is lost time with the patient. That's not difficult to understand. But if you look at these figures from Storuman municipality, where Center for Rural Medicine is based, as you know, we have 5,800 people living on 8,200 square kilometers, approximately 0.7 people per square kilometers. The home care team drives 100,000 kilometers per month. Every day, 10 full-time employees sits in a car, 365 days a year, 3,650 working days are workers sitting in a car due to the distances. So if we compare this to Stockholm had 970,000 inhabitants, 214 square kilometers, 4,500 persons per square kilometers. Of course, every lost minute in a car, on a bike, in a metro is a lost minute with the patient, but they have an opportunity and a possibility to organize the logistics a little bit different than when you have the great distances. So rural areas don't only have the challenge of an increasingly aging population due to the demographic challenge, they have also the challenge of long distances that cost maybe even more. So luckily, there is a solution that benefits all, both cities as well as rural areas. And by using digital means, distance spanning solutions, we can reduce the time in car and metro to almost 0 and time with patients to close to 100%. This is a potential that we need to utilize. And what we are saying is, with the digital shift, healthcare is milliseconds away, not hours away. So how do we do this then? Well, we need to learn from those who have succeeded. And one such area is EXO. They started their joint municipal healthcare and social care group, EXO, in 2010, serving 130,000 citizens. The situation for them, the challenge from start is similar to everyone else. Lack of resources, increasing the aging population. Same staff has to do more tasks and meet a higher need. But they also had the potential loss of a hospital. So they reached out, they started off by making far-reaching organizational change. They completely erased the organization map and started to draw a new map for organizing healthcare and care. They built this on a foundation of true regional collaboration with organizations across, and they supported this with technology. So the main vision that they took was functional ability at home, meaning that person-centered care. They took a holistic approach with heavy emphasis on digitalization. And with functional ability at home, they want to let as many patients as possible to stay at home. They even rebranded patients to customers. So some examples, what they are having here is that they have trucks going around with different type of healthcare provision services, go out to the different municipalities so they don't need to travel to the hospital. Always the digital approach, the first approach. Self-monitoring and self-care in people's own homes are the strategy that they are applying. This means that the hospital that they wanted to save is now partly empty because a lot of the healthcare services are provided in people's own homes. And they collect all the data in a regional data pool. This regional data pool is then provided with pings, and a ping is being given to a patient or a citizen that have a measure from self-monitoring that is out of normal range. And then that ping gives an indication that we need to be in contact with the patient and provide them with a solution or a potential cooking course or a training program from the football club. So they could actually stay out of healthcare and social care for a longer period of time. So the problems, the stories, the way forward, well, it is urgent, but it's promising. And action is the way forward. So learn more from Exotech. Look at these 3 key learnings from Exotech's ongoing digital shift, a film that we have published just recently. So look through that one to get inspiration. Thank you very much.